My friend Dr. Ahmed Al-Mandari, distinguished colleagues from the press corps, good day to you all and Ramadan Kareem. I join Dr. Ahmed in thanking you for being with us today at this press conference to mark World Immunization Week. These events are really a testimony to our partnership and the work that we continue to do together in the area of health, including to respond to the COVID-19 outbreak. Throughout our recent history, the history of the 20th century, it has been proven that vaccines work. Vaccines are safe and vaccines save lives. They protect children against preventable diseases, including measles, polio, and diphtheria. And vaccines also protect adults, as we've seen with COVID-19. Coming back to children, every year, thanks to vaccine, up to 3 million children survive around the world, including in this region. The region historically has been known for its near universal vaccine coverage, despite many humanitarian crises, conflict, and poverty. It's home to 55 million children under the age of 5, and those children historically have been vaccinated. In the last year, and despite COVID-19 and the interruption of immunization campaigns in the Middle East and North Africa, we have nonetheless seen that immunization in the region is still largely on track, and we need to continue to make the case for it to stay on track. At the beginning of the pandemic, some vaccination campaigns in the region did come to a halt, including those against polio and measles. And for a few months, we had nearly 15 million children who were at risk of missing out on vaccines in places like Djibouti, Iraq, Lebanon, Sudan, and Yemen. But towards the end of 2020, campaigns resumed and picked up and made up for most of what was lost. To date, we've reached 36 million children in a number of countries with some of these catch-up vaccination campaigns against polio, measles, and yellow fever. And this has happened at a time where health systems are overstretched and frontline workers have continued to work day and night on the COVID-19 outbreak response. So amidst very difficult circumstances, it's quite remarkable to see how immunization has been supported and has continued. This truly highlights the importance of public health systems across the region and the need to continue supporting and strengthening these, specifically to focus on immunization. At a global level, I also would like to note that UNICEF and WHO launched yesterday the Immunization Agenda 2030, which is a comprehensive plan to maximize the impact of vaccination over the next decade. This agenda is a global strategy to maximize the impact of vaccines. It aims at saving 50 million lives by 2030, halve the number of children receiving zero-dose vaccines, and achieve 90% coverage for key vaccines over the next decade throughout the world, including in the Middle East and North Africa. So that's on vaccines generally for World Immunization Week and the importance of vaccines as a life-saving intervention, one of the most cost-effective health interventions in the world. Let me now turn to the logistics and procurement part of immunization and speak also a bit specifically about some of the deliveries of COVID-19 vaccines. So UNICEF is the UN agency around the world that is responsible for the procurement and delivery of vaccines for children. This is also true in this region. In 2020, we were able to deliver 136 million doses of vaccines in the Middle East and North Africa, despite heavy restrictions, including curfews, lockdowns, or in many cases, closure of airspace or non-availability of flights. And these shipments included vaccines against polio, measles, tetanus, hepatitis, diphtheria, and TB, among others. This year in 2021, we're also on track. We've been able to deliver so far 25 million doses. And again, to repeat that same level coverage and availability of vaccines. Of those 25 million, 5 million were procured from the COVAX facility against the COVID-19 virus. And every country in the region, and for us it's Middle East and North Africa, has now received vaccines. This is an operation that delivers vaccines in the region with a focus on low and middle income country. And as we discussed last time we met, COVAX is an unprecedented initiative in its size and volume, one of the largest undertaking that the global community has taken and that the UN has been involved with since it was established 75 years ago. The latest country to receive vaccines out of the COVAX facility was Syria, with 256,000 doses delivered. Dr. Ahmed and I did the press release on this. It was delivered both in Damascus, but also in Idlib to serve the northwest, which is access cross-border from out of Turkey. And I highlight this specific delivery because it's such an important context. Syria is a complex emergency, 10 years of conflict, health systems that struggle. And despite that, there's a fully fledged immunization campaign addressing COVID in Syria. The third thing that I want to use my opening remarks to address is the issue of vaccine hesitancy, which Dr. Ahmed spoke to, but which we really urge the media to help us address and combat. Of particularly concern is hesitancy, and this is something that WHO and UNICEF working jointly have focused on and gotten the latest data on. It's hesitancy among health workers and young people, the very people that we want to be champions of this vaccine. So the hesitancy is mainly around safety and efficacy of the vaccines, and this is often due to false news and inaccurate information, and that is what we need to address. It's also sometimes due to the fact that health workers don't have the necessary protective equipment when they vaccinate, and again, we're working to make sure that that is in place. COVID-19 vaccine is absolutely critical in getting us out of the outbreak. If we don't vaccinate en masse, in addition to continuing with the primary healthcare safety measures, we're not going to be able to defeat this virus. It will mutate, it will become more dangerous, and none of us will be safe. So we must continue to convince everyone to get vaccinated and to continue the effort that we're in. Because the new variants become more transmissible, they become more difficult to address, and we need to be acting now and raising immunization levels that reach everyone. In closing, a few words on the way forward. We are committed, WHO and UNICEF, to protect child immunization across the region for future generations of children, for both routine and special campaigns to increase support to the healthcare system and frontline workers. Vaccines, when it comes to COVID, are not enough. We know it can get tiring, but we have to keep strictly following public health safety measures. The basic steps that Dr. Ahmed spoke about that are proven to save lives and protect us from COVID-19 and other diseases. Get vaccinated, but also wash your hands, wear masks, keep social distance, and avoid gathering until everyone is vaccinated. And then I know that WHO will come up with updated information and guidance. And finally, as we continue to work together to raise awareness about the important safety and efficacy of vaccine, whether for children or for adults against COVID-19, we have a huge responsibility on us to stop the myths and false information about vaccines and systematically introduce and provide evidence and science-based information to people around this region around vaccine and safety of vaccines. This is a job you can help us with in the media. The cheapest health intervention is to wash your hand. Vaccines is the second cheapest intervention. And as I said, it saves 3 million children every year, and it will be part of saving us from this virus. In conclusion, let me pay tribute for those who have lost their lives around the world and in our region. It's in their memory that we're holding these press conferences, that we're committed to fight this pandemic and to win. And vaccines are an essential part of that. Immunization is an essential part of that. The COVID-19 immunization effort is an essential part of that. Thank you.